Hello and welcome to this special show. With close to 6 lakh global cases of COVID-19, more and more nations, including India, going into lockdown across the world in order to flatten the curve, a growing controversy now over China's role in COVID-19 and its influence on the World Health Organization, the global body that's at the center of the battle against the novel coronavirus. Now, critics have alleged the world is suffering because China caused a global pandemic. They say China hid facts in the early stages, silenced doctors who spoke out, and used its clout in the WHO to underplay the human-to-human transmission of the novel coronavirus. And that delay allowed over 5 million Wuhan residents to leave the city and spread the virus first within China and then around the world. China, on the other hand, is pitching its subsequent crackdown against COVID-19 as a model for the rest of the world. It's even donating medical supplies. China, now beyond the global pandemic, has this really become about global geopolitics now? That's what we're going to explore over the next half hour.
Hello and welcome. I'm Nidhi Razdan, working from home in these unprecedented times as we look at how this pandemic was handled by the World Health Organization and by China from where it all started. Although we are largely focusing on solutions and what can be done to come out of this pandemic, we do feel it is important to see what has happened over the last few months to perhaps fix responsibility, to fix mistakes, to see whether global response will be different going on from here forward. Joining us on NDTV this afternoon, we have Dr. David Nabarro, the WHO Special Envoy for COVID-19, joining us from Geneva via Skype. Mr. Navdeep Suri, a former diplomat and distinguished fellow of the Observer Research Foundation. Anand Krishnan is the former China correspondent for The Hindu, currently in Chennai. And Mihir Sharma, senior fellow, also with the ORF, joining us this day as well. Dr. Nabarro, to you first, if I could ask you straight off on how you're responding to the criticism that the WHO is facing for its handling, particularly given the fact that the WHO is being criticized for perhaps being too lenient on China's point of view, telling countries in the beginning that there was no human-to-human transmission possible. That was in mid-January when the evidence was, completely the opposite by that time. Indulging China in a sense in the statements that the WHO made. How would you respond to that criticism?
We've known about this virus as a world for 3.5 months. We're learning all the time. We have to listen to the experiences of different countries, and we are putting together an understanding of where the disease is going. Our total focus now, and my total focus now, is looking forward. As far as I'm concerned, any historical analysis should be done once we put all our hands and hearts and minds together on this epic struggle. So I'm looking forward. Please, I'm not really in a position at all at this stage to do postmortems. We're far too early in dealing with something of extraordinary global significance. Let's just work together on getting on top of the outbreak, getting outbreaks and getting on top of the pandemic, and then do the analysis some months later. We've got plenty of lessons to learn from countries that have been able to get on top of their own coronavirus situation, particularly South Korea, particularly Singapore, and let's apply those lessons as widely as we can. People are suffering and people are dying, and we have to focus on that issue.
But Dr. Nabarro, when you talk about getting on top of this global pandemic and learning from the lessons that we've seen or witnessed in the last 3.5 months, would you say that perhaps there are lessons to be learned there? Why, for instance, the WHO didn't have boots on the ground in China in the early months? The fact that a WHO team visited Wuhan only in mid-February. Would you say in hindsight that, perhaps things could have been done differently?
In any kind of outbreak like this, we have to work with the information that we have at the time. I have been with the World Health Organization Director General during January, and we had plenty of information to indicate what was going on, which was shared by the member states. The country you're talking about invited a WHO mission to come in and do a fully detailed examination of their experience during February. They went everywhere they needed to go. They produced a report that was on the internet. Within 2 days after their return, they had press conferences in Beijing. We have had plenty of information from China from which to provide material that others can draw on. And that is, I think, very, very open, as far as I'm concerned, collaboration during that period. And I would encourage everybody to just use their time and energy to focus on looking forward and picking up on all the lessons from all over the world, from Europe, from the US, from Southeast Asia, and now this enormous amount of activity underway in India. Let's focus on that, please.
But Dr. Nabarro, I think the reason why there are so many questions about the WHO's response is also because when we saw the SARS outbreak in 2002, 2003, we saw that the WHO was very critical at that time as far as China was concerned. China was criticized by the WHO back then for delaying vital information and was quick to suggest travel restrictions as well. The response this time was the complete opposite. And that is why people are drawing these parallels and asking what happened. This is a much bigger crisis, health crisis that we're dealing with.
I was inside the World Health Organization during the time of the SARS outbreak that you're referring to in 2003. And I would say that all of us have learned a great deal since that coronavirus appeared about the need for speed, about the need for comprehensive responses, and about the need for communication. The base sequence of this particular virus was made available publicly very quickly. The details of the disease associated with this virus were made available immediately during the month of January. All countries have at times have their own ways of communicating what's happening with the international organizations, and as far as I'm concerned, there was a very rapid understanding of what was happening in China during January, and then a very immediate involvement with the Chinese authorities during February. Whilst I'm sure that you and others will want to examine what's going on, we in the World Health Organization are focused entirely on a global pandemic that is doubling in size every 3 days. And we see an enormous need for everybody to learn lessons from experience, which we post daily on our website, and our Director General speaks about it every day. Please let's focus on what matters now. We've got a massive challenge on our hands.
A massive challenge indeed. But there are lots of research papers that are looking at those initial days and months. Navdeep Suri, let me put this across to you. Samir Saran, your colleague at the Observer Research Foundation, talks about how the WHO DG, Dr. Tedros, applauded China's commitment to transparency despite evidence to the contrary. What was this evidence that's being talked about?
I think it's a little facile to say at this point that let's just move forward and let's not look at what happened in the last 3 months. I think the timelines are pretty clear. The virus was first discovered, I think, in early November in China. You have reports from the Global Times of China saying in early December that it was spreading potentially from a Wuhan seafood market. And yet it took WHO another 4 weeks. I think the first statement that came out of WHO on the 13th of January, 4 weeks later, was a reiteration of the Chinese perspective that there was no human-to-human transmission likely in this case. And another 10 days, January 24, before again following up on the Chinese acknowledgement that human-to-human transmission was happening, the WHO also endorsed that position. So I think the world lost precious weeks during that time because the WHO was not taking an independent position as an expert body in which the world has a trust, but rather taking a line which seems to be written in Chinese.
Let me take this to Mihir Sharma. Mihir, do you believe that that this is part of the problem, which is what Mr. Navdeep Suri seems to suggest, a politicization of our institutions, multilateral institutions, world institutions like the WHO? And how do you see, Mihir, the Chinese response to it, and how the world is going to deal with China once we deal with this pandemic and this is over? What's going to change in terms of the way the world deals with China?
I think that this is one of those occasions when we realize that institutions designed for a liberal order, such as the Bretton Woods institutions, such as institutions such as the WHO, are now being now have this very large presence of a notably illiberal state, namely the People's Republic of China. And that has altered in many ways how they engage with their traditional constituents. Now, in this case, what a multilateral organization like the WHO will say is that we will have to repeat what our member states tell us, right? However, if the member states are essentially illiberal, authoritarian, controlling of what they release in a particular kind of way, then I think that it is past time for the multilateral organizations that have to deal with them to change how they approach this. So they have to become a filter, not a replicator, right? I mean, in this case, for example, June 13th or June 12th, the WHO puts out its statement on the Wuhan coronavirus, and the travel restrictions part of that says no travel restrictions are necessary. And Jan 15th, the first patient flies from Wuhan to the US. The person who becomes patient zero in the US flies from Wuhan to the US. So, I mean, there is, in some sense, when people start looking at these timelines, they're going to become very, very concerned about the fact that we did not take action earlier. And given that we did not take action earlier, they're going to look at the influence, the outside influence that Beijing has on multilateral organizations in general. I do not want to single out the WHO.
Yeah, sorry, if I could just follow up on that to Anant Krishnan. Anant, you know China so well, having lived and worked there for so many years. What Mihir was just talking about in terms of, when you deal with an illiberal authoritarian regime like China, I have a concern, I think many of us do, that when the Chinese government today is giving out figures of recoveries and how it has supposedly brought things under control, what do we believe? I think that's a fundamental question that bothers a lot of us. Do we believe the data the Chinese government is putting out today?
No, I think it's a good question, and it's useful to go back a little bit to what happened in December and January. I was in Beijing actually on Jan 10th, which is when I landed there, and no one had any idea at the time of what was happening. And I think when January 20th was when we finally heard from the Chinese government that there was a serious problem happening. And I can tell you that there was so much anger among people in China that they were being kept in the dark. And I think a lot of that's been forgotten now. And what we did know was that actually in December, Chinese doctors in Wuhan did really well to identify this new virus. It was sequenced by December 31st. And I think the 21 days from December 31st to January 20th was when really big mistakes were made. And this coincided with about 200 million Chinese traveling for the Chinese New Year starting Jan 10th. And a lot of this could have been prevented, which is why it's important to remember those timelines. And I think we should also try and not forget that a lot of the questions that are being asked in China's handling were by Chinese journalists, by Chinese citizens, because now it's kind of being framed as the rest of the world finger pointing at China. So I think it's also important for us to remember that a lot of these questions are being raised within China itself.
Dr. Nabarro, would you respond to that as well in terms of the broader global engagement with China? I mean, here we have China now offering to help with medical supplies, say countries like Italy, Spain, who are now perhaps not being able to flatten the curve in the way Chinese authorities have claimed they've done. But here in India already there are reports that Spain, that Italy are talking about how Chinese testing kits, for instance, have proved to be not as efficacious and not as sensitive to the virus as they should be. So, an Indian government, for instance, that's thinking at this point of taking up China's offer, what should India do?
I want to encourage all nations to work together on finding the best ways to help people and countries push back and then eventually suppress this pandemic. And if there are ways in which we could get all nations actually having one comprehensive global strategy and working on that, it would be great. I'm also very very keen that the different member states who actually govern the World Health Organization can work together in as harmonious a way as possible. It's often in a crisis like this a time when people do seek possible scapegoats for activities, but I just really do want everybody to not spend their time looking backwards, but to move forwards. And if they do want to analyze the history and be critical of anybody, and we're all accountable in the multilateral system, let's do it when we've actually managed to suppress this thing. Now I really do want to focus on moving forward, learning lessons as we go. I'm sorry, I'm not going to say anything else from this, because I am, as a global citizen, totally committed to helping everybody to reduce the suffering. There's no point in doing anything else. We shouldn't waste time doing anything else. Right now, it is just one thing that matters, which is trying to reduce the suffering and the death and the disruption associated with this pandemic. And please, all of you who want to do commentaries on it, fine, and let's do it. But please, can I and my colleagues who are working flat out 24/7, trying to help countries all over the world to do the best they can, please recognize that that's our focus, and I'm not going to say anything else.
Dr. Navarro, I think we all agree that the focus has to be to get out of this pandemic, but respectfully, I think we also need to look at where we went wrong, because that is the only way we are going to learn from this and make sure we do not commit the same mistakes in the future. And that is why, unfortunately or fortunately, we have to ask some very difficult questions, including of the World Health Organization, including of our neighbor, China. Navdeep Suri, last comments from everyone. How do you see the responses, global responses changing from here on, Navdeep Suri? Do you think that, given that Prime Minister Modi actually at the G20 video conference the other day flagged this issue of the WHO and that it's been framed by rules of the last century, is that what the focus is going to be on now? How to revamp institutions like this, not just the WHO, but others too?
I think there's a real fear that other organizations should not follow this line. We do not want multilateral institutions, international organizations to acquire Chinese characteristics in a manner of speaking. We want them to be independent and we want them to be representative. So the idea of a revamp of the international institutions has been around for a long time, but I think what we have seen in the last 3 or 4 months is really a wake-up call for many of us around the world that we need to focus on this. I think what made it particularly galling is the blatant effort by China to rewrite history before our eyes, to suddenly unleash a narrative before us that, oh, maybe the virus originated from the United States, or maybe a laboratory was shut up in Bethesda because there was a virus over there. And now let's forget
that the US Army dropped it into Wuhan, not just originated. I mean, that was even more absurd.
Yeah. So I think it's that blatant nature of trying to manipulate information and create fake news before our eyes. And for me, to see several of our reputed publications buy that hook, line, and sinker and republish articles from the Global Times in that fashion, it really is a wake-up call for us.
Anand Krishnan, you've actually talked about how China's response since late January has actually been quite exemplary, but it also sort of showcases this very massive top-down approach that China took. Now, is that something that is even feasible for other countries around the world? And are there lessons to be learned from the Chinese example?
I don't think it's just China. I mean, I think there's a lot of evidence to suggest that South Korea, Taiwan have all done very, very effective strategies that might be more applicable to a country like India. But just to go back to the point that you made on the WHO, I think it's so important for all of us to have an independent source of information when it comes to public health. And for various reasons, the WHO functions within limitations, as I remember from my time in China as well, where they are reliant on the information provided to them by the Chinese authorities or authorities in any country. It's not just a China issue. And I think for that reason, a lot of the information and advisories we were getting in January were kind of reflecting what the Chinese government was saying. And I think going forward, this being beyond just a China-specific issue, I think there has to be some reflection at a later date, as Dr. Navarro was saying, in ensuring these things don't get repeated again.
We're almost out of time. Quick question, Dr. Nabarro, on what India is doing now. We have a 3-week-long lockdown that is in place. How do you think India is handling it? How do you sort of look at the trajectory of this pandemic in India?
Thank you. The WHO advocates a comprehensive strategy that focuses on interrupting transmission where it occurs in communities, supported by hospitals that are ready to treat people with COVID-19, and when necessary, lockdowns to improve the distancing and to reduce opportunities for transmission. I've studied what's happening in India from a distance, and my colleagues in the World Health Organization regional office keep me fully informed. And as I see it, this is the right way to go, to use the period of lockdown to build up community-level public health services and at the same time to repurpose what's happening in hospitals, but to make certain that people everywhere are on the alert and are able to detect and then isolate individuals who have COVID-19. So I'm saying this is based on what's happening in other countries, the right direction to go. And we obviously support India in the work it's doing and support the people of India in their epic struggle as much as we possibly can.
Dr. Nabarro, would you though say that there was any other course of action that might have worked in the Indian example? Because a lockdown, of course, is going to have sort of devastating effects that go beyond just the fight against the coronavirus.
And do we need to test more?
We're very clear that you have to have community-based capacity, and that includes, where you can, testing for the virus. It includes, where you can, capacity for isolation and medical treatment. But having worked in your country and grown to really enjoy working with people, I actually think it's the organization at the community level and the capacity of the local health workers in their health centers to maintain surveillance over local populations that's going to be key in transmission interruption. And if the testing can be rolled out so that people with symptoms can know their virus status, that will be an added bonus. We're seeing the same challenges in many other countries, but I applaud the speed with which India has acted when the numbers of cases were quite low. That is, as far as I'm concerned, and as far as the WHO Director General is concerned, the right strategy to adopt.
Well, fingers crossed that that India is able to handle this better than other countries.
You need luck, but you need judgment and wisdom as well. And I really, really give all my best wishes to the people of India at this time.
All right. Thanks very much indeed.
Nabarro. This wasn't a finger-pointing exercise. We want to say that again. I think the point is to find a constructive way to go ahead while learning from the mistakes of the past. Thank you very much to all of you for joining us. Thank you.
Thank you for watching.